questions. Healthcare is facing unprecedented challenges. We hear wait times are at record levels, there are staffing shortages, costs are increasing, demand is exceeding capacity. And we know there's no simple fix, but something really does need to be done. Can you give us some specifics on what the government's doing or planning to do to solve the problems?
Yeah, absolutely, John. And you are absolutely right that healthcare is a huge budget item within the province of Ontario, and it's critically important to our health. But let me start from the outset and say some of the conditions we're facing in the healthcare sector are not just in Ontario. You can look right across the country. The exact same problems are paramount in every province. And the United States, if you watch the US news, you'll see the same thing. Hospitals are at full capacity right now with the flu and various viruses, and indeed globally. So let me start out by saying we are not immune. Ontario's not an island. But nevertheless, the health and safety of the people of Ontario is paramount to the government of Ontario, and there's a lot that needs to be done. There's absolutely no doubt about that. So as a government, what we've been able to do is we've hired thousands of more healthcare workers. We need to hire thousands more. We need to speed up foreign credentials for medical professionals, and we've been doing that. So we've been working with the College of Nurses, for example, so to encourage them and to speed up the foreign credentials so that nurses and doctors, for example, in the province of Ontario, can work it within the system as quick as possible, knowing that we have standards to maintain. We're not going to lower any standards here, but if there's a way that we can speed up foreign credentials, that's critically important. We've been doing that. We've also initiated the first medical school in the GTA in over 100 years. And you heard that correct, over 100 years. We're going to be building a new medical school in Brampton to train well over 100 doctors per year. And these things take time, though. There's no quick fix. We have, with our budget, and as a parliamentary assistant to finance, I'm certainly involved in helping to initiate the budget. I can say that we have spent more than any government in the history of Ontario on healthcare. Money is not the only issue, though. It is making sure we get healthcare professionals trained in a timely manner. So there's a lot to be done. Long-term care is another issue. We've put through legislation recently, just in this last term since being reelected, that will hopefully speed up people getting into emergency rooms and into hospitals, because there's a log jam of people that should really be in a long-term care facility that are staying in hospital beds, and we need to get them so that they can be looked after in a more effective manner in a long-term care home as opposed to hospital. So that will help free up some of the beds and capacity at the hospitals, which are definitely stretched right now. We all know that. So there's a lot to do, a lot to be done. It's not going to happen overnight, but I think we're certainly on the right track to making improvements in our healthcare system.
Okay. Effie, did you want to comment on what Stephen had said?
Yes, I'd like to just add, I think that Stephen did a very fulsome response in terms of everything that the government is doing. And I guess what I would add is that this fall, we've really seen a perfect storm in terms of our healthcare. We've had not only the challenges of COVID in the last 2.5 years, but we also have the flu season, and we also have the RSV virus, which has been particularly difficult to young children. So our community is really going through quite a health crisis. Addressing it has not been easy. It's been very challenging. A lot of the investments had already started. As Stephen mentioned, we already had added 6,000 more healthcare workers, including nurses and personal support workers. We've added already 3,500 new critical care, acute and post-acute hospital beds, and over 11,000 healthcare workers, including nurses and PSWs. So the one aspect that Stephen mentioned too around internationally educated individuals, we've got 900 internationally educated nurses that are now being deployed across hospitals in Ontario to be able to gain the practical experience they would need to practice in Ontario. So it's all hands on deck. We're working on multiple levels in order to address the crisis. The other part that I wanted to mention was that in terms of overall infrastructure investments for hospitals, over the next 10 years, the government is going to be investing $40 billion in hospital infrastructure, and that includes 50 major hospital projects, adding 3,000 new beds. So the task is monumental, but it's extremely important for us as a government to ensure that all of Ontario gets the healthcare that they need.